Hey everyone, and welcome back to our channel. I'm thrilled you're joining me today because we're diving into a topic that unfortunately affects many people worldwide: stomach ulcers. These are essentially painful sores in the lining of your stomach or the first part of your small intestine, and they can cause a whole lot of discomfort, from burning pain to bloating and nausea. It's something that can really impact your quality of life, making even simple things like eating a meal a source of anxiety. We want to shed some light on this common issue and talk about ways to find relief and support your body's natural healing processes. Now, stomach ulcers can be caused by a few different things, most commonly an infection with bacteria called H. pylori, or long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or aspirin. It's super important to get a proper diagnosis from your doctor if you suspect you have an ulcer, as they can help determine the cause and the best course of medical treatment. While conventional treatments are often necessary, especially to eradicate H. pylori, today we're going to focus on the complementary role of nature. We'll be exploring natural remedies that can help alleviate the discomfort and promote healing, working alongside your doctor's advice. Our goal here is to empower you with knowledge about gentle, natural options that can support your digestive health. These aren't magic cures, but they can be incredibly beneficial additions to a comprehensive approach to managing stomach ulcers. We'll look at what science says, how these remedies work, and how you might incorporate them into your wellness routine. So if you're looking for ways to naturally soothe your stomach and aid its recovery, you're in the right place. Let's get into it. First up, let's talk about a plant many of you probably already know for its skin-soothing properties: aloe vera. This succulent has been used for thousands of years, not just for sunburns, but also internally for various digestive ailments. When it comes to stomach ulcers, the inner gel of the aloe vera leaf is packed with compounds that can be incredibly beneficial. We're talking about polysaccharides like acamanan, which are known for their anti-inflammatory effects. Imagine that cooling relief you get on sunburned skin, but for the inside of your stomach. Aloe vera can create a soothing coating over the ulcer, protecting it from the harsh environment of stomach acid and digestive enzymes, which can really help to reduce that burning pain and discomfort. The benefits of aloe vera for stomach ulcers extend beyond just soothing. Some research suggests it can actually help to reduce the production of stomach acid, which is a key factor in ulcer irritation and pain. Furthermore, aloe vera has properties that can promote tissue repair and regeneration, which is exactly what you want when you have a sore in your stomach lining that needs to heal. There's even some evidence indicating that aloe vera possesses antibacterial properties that might play a role against H. pylori, that common bacterial culprit behind many ulcers. While it's not a replacement for antibiotics if an infection is present, it can certainly be a supportive player in creating an environment less hospitable for such bacteria and more conducive to healing. So, how can you use aloe vera for your stomach? It's really important to use pure aloe vera juice or gel that's specifically prepared for internal consumption. You don't want the whole leaf products that contain aloin, which can be a harsh laxative. Look for high-quality inner leaf juice. A common suggestion is to take about 1 to 2 tablespoons, perhaps 2 to 3 times a day, ideally before meals, to help coat the stomach. As with anything, listen to your body. Some people might experience mild digestive upset initially. And of course, if you're pregnant, breastfeeding, or on medications, especially for diabetes, it's crucial to chat with your doctor before adding aloe vera to your routine, just to make sure it's a safe choice for you. Next on our list are probiotics, and these tiny powerhouses are all about restoring balance to your gut microbiome. You've probably heard a lot about gut health recently, and for good reason. Probiotics are essentially live, beneficial bacteria and yeasts that, when consumed in adequate amounts, confer a health benefit. Your digestive tract is home to trillions of microorganisms, and maintaining a healthy balance of the good guys versus the potentially harmful ones is crucial for overall well-being. And especially so when you're dealing with something like a stomach ulcer. An imbalance, sometimes called dysbiosis, can weaken your stomach's natural defenses and make it harder for an ulcer to heal or even contribute to its development. So how exactly can these friendly microbes help with stomach ulcers? Well, some strains of probiotics have been shown to directly combat H. pylori, the bacteria I mentioned earlier. They might do this by competing with H. pylori for nutrients and space to attach to the stomach lining, or by producing substances that inhibit its growth. This is a really exciting area of research. Furthermore, probiotics can help strengthen the mucosal barrier of your stomach. That's the protective lining. A stronger barrier means better defense against stomach acid and other irritants. And if you are undergoing antibiotic treatment for H. pylori, which can unfortunately wipe out good bacteria along with the bad, taking probiotics can help reduce some of the common side effects like diarrhea and support the recovery of your gut flora. When it comes to scientific backing, there's a growing body of evidence supporting the use of probiotics as an adjunct therapy for H. pylori infection and for overall gut health, which indirectly supports ulcer healing. You can get probiotics from fermented foods like yogurt with live active cultures, kefir, sauerkraut, kimchi and miso. These are fantastic whole food sources. Alternatively, probiotic supplements are widely available. If you go the supplement route, look for products that list the specific strains, have a good colony forming unit, CFU count, often in the billions, and are from reputable brands. Strains like Lactobacillus and Bifidobacterium species are often studied for their benefits in this context. As always, consistency is key, and it might take a few weeks to notice benefits. Let's move on to something a bit sweeter, honey. Now, I'm not just talking about the stuff you drizzle on your toast for flavor, though it is delicious. For centuries, honey has been recognized for its remarkable medicinal properties, particularly in wound healing. Its benefits aren't just old wives' tales, there's some solid science behind them. Honey is packed with antioxidants, which help fight off cellular damage, and it possesses natural antibacterial and anti-inflammatory properties. These characteristics make it a very interesting candidate for helping to manage stomach ulcers, which are essentially internal wounds that are often inflamed and can be complicated by bacterial presence. When we talk specifically about stomach ulcers, certain types of honey, especially Manuka honey from New Zealand, have gained a lot of attention. Manuka honey has potent antibacterial activity, even against antibiotic-resistant strains, and research has shown it can be effective against H. pylori in laboratory settings. It's thought that honey can help by directly inhibiting the growth of this bacteria in the stomach. Beyond its antibacterial effects, honey can also help to reduce inflammation at the site of the ulcer and create a protective coating over it, much like aloe vera, shielding it from stomach acid and promoting a better environment for the damaged tissue to repair itself. This can lead to a reduction in pain and faster healing. There have been several studies investigating honey's role in gastrointestinal health, with some indicating its potential to support ulcer healing and combat H. pylori. If you're considering using honey, it's best to opt for raw, unprocessed honey, as pasteurization can destroy some of its beneficial enzymes and compounds. Manuka honey, with its certified UMF, unique Manuka factor, or MGO, methylglyoxal rating, is often recommended for its stronger medicinal properties, though other raw honeys can still be beneficial. A common way to take it is 1 to 2 teaspoons a day, perhaps on an empty stomach first thing in the morning, or dissolved in a little warm, not hot water. It's a simple, natural approach that many find soothing and helpful. Of course, if you have diabetes, you'll need to be mindful of the sugar content and discuss it with your doctor. Another powerful botanical we need to discuss is licorice root. This isn't about the sugary candy, but the actual root of the Glycyrrhiza glabra plant, which has a long history of use in traditional medicine for digestive complaints, including stomach ulcers. However, there's a very important distinction to make here. Regular licorice root contains a compound called glycyrrhizin, which can cause side effects like increased blood pressure, water retention, and low potassium levels if taken in large amounts or for long periods. That's why, for stomach ulcers, we specifically recommend deglycyrrhizinated licorice, or DGL. This form has had most of the glycyrrhizin removed, making it much safer for regular use while retaining its ulcer healing properties. So, how does DGL work its magic? Unlike some medications that aim to drastically reduce stomach acid, DGL works by supporting and enhancing your body's own natural protective mechanisms within the stomach. It's thought to increase the production and secretion of mucus by the stomach lining. This mucus acts as a vital barrier, protecting the lining from the corrosive effects of stomach acid and pepsin, an enzyme that can aggravate ulcers. Think of it as reinforcing your stomach's own defensive shield. Additionally, DGL may improve blood flow to the stomach lining, which is crucial for delivering nutrients and oxygen needed for tissue repair. And it might also promote the growth and lifespan of intestinal cells, further aiding in the healing process. Incorporating DGL into your routine is quite straightforward. It's most commonly available as chewable tablets, and there's a good reason for that. Chewing the DGL tablets allows the active compounds to mix with your saliva, which is believed to activate them and enhance their effectiveness in coating and protecting the esophagus and stomach. The usual recommendation is to take 1 or 2 chewable tablets about 20 minutes before meals, and perhaps again before bedtime if needed. This timing helps to get that protective coating in place before food, and therefore stomach acid production, increases. Always follow the dosage instructions on the product label. And as with any supplement, if you have underlying health conditions or are on medication, a quick chat with your healthcare provider is a smart move. Our final natural remedy might sound a bit unusual to some, but it has a fascinating history when it comes to stomach ulcers. Fresh cabbage juice. Yes, humble cabbage. This cruciferous vegetable has been lauded for its ulcer healing properties for decades, largely attributed to a compound often referred to as vitamin U. Now, vitamin U isn't technically a vitamin in the traditional sense. It's a term used for S-methylmethionine, a derivative of the amino acid methionine. This compound is found in raw cabbage and is believed to play a significant role in healing the mucosal lining of the gastrointestinal tract. It's quite an interesting story how this came to be recognized. The benefits of cabbage juice for ulcers, particularly peptic ulcers, were notably highlighted in studies back in the mid-20th century. For instance, research conducted by Dr. Garnett Cheney in the 1950s showed surprisingly rapid healing of peptic ulcers in patients who drank fresh raw cabbage juice daily. The vitamin U is thought to work by strengthening the stomach lining, protecting it from acid damage and accelerating the repair of damaged tissues. It essentially helps to mend those sores more quickly. While more modern, large-scale clinical trials are perhaps less common, the historical data and anecdotal evidence keep cabbage juice on the list of respected natural remedies for ulcer care. It's a testament to how traditional wisdom sometimes intuits what science later explores. Many individuals who have tried cabbage juice for ulcers have reported significant relief from pain and discomfort, sometimes quite quickly. If you're thinking of trying it, the key is to use fresh raw cabbage juice. You can make it at home using a juicer. Some of the early studies used about a quart of juice per day, sipped throughout the day, but that can be a lot for some people to manage, both in terms of preparation and consumption. Starting with a smaller amount, perhaps a cup or so a day, might be more practical. It's important to note that the taste can be quite strong, and some people might experience gas or bloating initially, especially if they're not used to a lot of cruciferous vegetables. Drinking it fresh is crucial, as vitamin U is thought to degrade over time. It's a commitment, but one that many have found worthwhile. So there you have it. 5 natural remedies that can offer support and relief if you're dealing with stomach ulcers: soothing aloe vera, gut-balancing probiotics, antibacterial honey, especially manuka, protective DGL licorice, and the historically acclaimed cabbage juice. We've covered how they work and how you might incorporate them. Remember, healing is a process, and consistency with these natural approaches, alongside any medical treatment, is key. Listen to your body, be patient with yourself, and celebrate the small victories along the way as you support your stomach's natural ability to heal. These remedies are tools to help you on that journey. However, and this is incredibly important, please remember that while these natural remedies can be very helpful, they are not a substitute for a proper medical diagnosis or prescribed treatment from your doctor. If you suspect you have a stomach ulcer, or if your symptoms are severe, persistent, or worsening, it is crucial to see your healthcare provider. They can perform the necessary tests, determine the underlying cause, and recommend the most appropriate medical interventions. Always discuss any natural remedies you're considering with your doctor to ensure they are safe and appropriate for your specific situation, especially if you have other health conditions or are taking medications. Thanks for watching. I truly hope you found this video helpful and informative. If you did, please don't forget to give it a thumbs up. Leave a comment below with your thoughts or experiences. I love hearing from you. And of course, subscribe for more health tips and remedies from Wellness Healthy. Taking proactive steps for your health is one of the best investments you can make. we're here to provide you with reliable information to support you on that path. Stay healthy and take care.